Welcome back to Skinfluence. I'm Dr. Dustin Portela. Today we're going to be talking about a topic near and dear to my heart, and that is hair loss.
Oh, the good old hair loss. Well, we are going to go into what is the cause of hair loss, mostly male and female pattern balding. We'll go into what it is, what are the treatment plans, what are some things that affect it and can help maybe improve it, and how to manage hair loss.
Yeah. Some people can manage it better than others.
Yeah. Well,
I am alive and thriving.
you're doing great.
Yeah. For those that have not seen me on social media but are just listening to the podcast, I am bald.
Yeah. I'm not.
So let's talk about the science of hair loss. Why is this happening? And ultimately, the way that we understand androgenic alopecia, which is male pattern hair loss or female pattern hair loss, is under the influence of hormones.
Yep.
We like to say that if your mother's father was bald, you stand an increased chance. And that is not a direct relationship.
No.
However, there is a genetic component to hair loss. And for the record, my mother's father was bald. So
okay. My mother's father, by the time he passed away, he was pretty bald.
Yeah.
So it's coming.
Yeah. My mother's father was bald. My father's father was bald. My father has gone bald.
Oh, yeah.
So I knew that I stood no chance.
Yeah.
So,
but you just own it.
I do. I just own it at this point. But I didn't
great.
for a while. We can talk about some of that in my personal journey. But ultimately, what we understand about how this works is that testosterone is the driving cause of hair loss. Testosterone, as it circulates through the body, it encounters an enzyme called 5-alpha reductase, which is present in different tissues of the body. One of those areas is in the prostate for men, and one of those areas is in the hair bulb for the hairs on only a certain part of your head.
Yeah.
The 5-alpha reductase enzyme, when testosterone gets to that, it is converted into something called dihydrotestosterone, which has a negative impact on the hair follicles and causes them over time to miniaturize, is the term. They get thinner and thinner until they just go away.
Yeah.
Now this only happens on the this only happens on the top of the scalp. Those are the hairs that are sensitive to hormones. The hairs on the back and on the sides are not sensitive to DHT. And that's why you see that classic look of the guy who's bald on top and has that, horseshoe ring, So that is what happens. And so as we talk about some of the treatments for hair loss, we'll talk about how we influence those hormones.
Yeah.
But that is the basic science. And it happens the same in women. Some women are genetically predisposed to be more sensitive to the effects of hormones on their hair as well. And although women have a much lower amount of testosterone than men, testosterone is still the most abundant hormone in women. And a lot of people don't know that.
Yeah.
So women still have more absolute amount of testosterone than estrogen, but estrogen is just a much more powerful hormone at low doses.
Yes. And it's thought that estrogen actually counteracts the effects of dihydrotestosterone. And so that's why they don't get balding as frequently or as often or as severe as men.
Yeah, until they go through menopause and they lose some of the impact of estrogen. And then the impact of the testosterone, the dihydrotestosterone, starts to become manifest.
Yes.
More commonly in women after they've gone through menopause.
So let's talk about the emotional impact that hair loss has.
Yeah.
Now, for my own self, about 5 years ago, or probably longer now, I was at work, minding my own business, charting away, and my MA took a picture of my scalp and said, "Dude, you're getting thin." And she took a picture, and you could see my scalp throughout. And I was like, "Oh no!" So it is very normal and natural to have an emotional connection to your hair.
Yeah,
it is part of your identity.
Yeah. Men certainly experience this, although it's not as well appreciated as in women.
Yeah.
Women and their identity is much more tied to having a full head of hair. And there's more social stigma on women who are balding than there are for men who are balding. It's just socially acceptable because it's so common that, up to 80% of men will experience some degree of thinning. But women also, sometimes in the order of 30 to 50% will notice thinning, but, balding appearance is not as common in women. So when they experience it, it is much more emotionally distressing because the social stigma, the social standards are different for men and women.
Do you find you see more men or women coming into the office for hair loss treatments?
Certainly more women come in for hair loss treatments, and it's because of that emotional impact. When they start losing their hair, they're much more likely to come in early and be more aggressive in their treatment requests. And, the men that come in, again, it is helpful if you can come in earlier, but by far, in my experience, women seek hair loss treatments more than men.
I would agree with that. I see quite a few women coming in, different types of hair loss, but definitely there is, because of the emotional factor to it and the identity, we see more women than men. Now, are there lifestyle factors that you've noticed that contribute to hair loss, or is it purely, if it's going to happen, it's going to happen?
I think a lot of ways when it comes to androgenic alopecia, the hormone pattern hair loss, if it's going to happen, it's going to happen. There's less impact on your lifestyle there. Now, that being said, if you are predisposed to that and you take testosterone exogenously, you're going to accelerate that process. If you are metabolically unhealthy, if you eat a poor diet, if you're not physically active,
poor sleep
quality, all of that, your body's going to prioritize function over appearance.
Totally.
And it's going to try to keep the heart, the brain, the kidneys, the liver working. And so it's not going to shuttle as many resources to hair growth. And so we see that, I think of that Simpsons character who plays video games. The big guy.
In the basement.
Yeah, in the basement. But, if you're not metabolically healthy, you're going to notice that it does impact your skin, your hair. And so that is something to be aware of, the healthier that you can be. So, but it's kind of a catch-22. If you're a guy and you're lifting heavy weights, you're going to have higher testosterone that can accelerate your hair loss. So there's different lifestyle habits that certainly play a role. Lifestyle habits, I think, play a bigger role in other types of hair loss. Predominantly, and we're not going to spend a ton of time talking about this, but there's one called CCCA, Central Centrifugal Cicatricial Alopecia. And this often can begin by tension on the hair, by tight hairstyles, and then it leads to a rapidly progressive scarring type of hair loss that starts in the center. And this is more common in African American women. There's traction alopecia, so people that wear tight braids, whether it's men or women. When you have chronic tension on that hair follicle, it stresses the hair follicle, and it can lead to a scarring type of hair loss. There is a condition called
trichotillomania.
There's a condition called trichotillomania where people compulsively pull their hair. Eventually, that can lead to scarring hair loss. They need a mental health professional to help with that. I have diagnosed it in children primarily.
Mostly children.
Don't realize they're doing it or are afraid to admit to their parents that they're doing it.
Living a stressful life or a stressful home environment. And when you mention cicatricial alopecia, many times that is a permanent type of alopecia if it's not controlled early enough.
There are other types of hair loss that are more common in women, and that's going to be telogen effluvium. This is where somebody goes through a stressful event in life, and then they get rapid shedding of their hairs. And you can lose 30 to 50% of your hairs in these circumstances. The reason that it's more common in women is that this often happens after delivery. If you've been pregnant, you notice your hair starts to get thicker during that time. You've got the estrogen going. And then the rapid change in hormones and just the stress of going through delivery can cause rapid shedding. And many women have experienced this. And that's the most common form of telogen effluvium. But losing a loved one, losing a job, getting in a major accident or having major surgery, especially if it was unexpected, those are the types of things that could lead to telogen effluvium, where your body, again, is prioritizing function over appearance. And you can have rapid shedding. Most people will recover from that, but some people have a difficult time recovering from that.
As dermatology providers, when we see that, oftentimes it's a lot of reassurance and knowing that your hair is going to grow back. But so we discussed a lot of the lifestyle factors that could maybe contribute, but most of the time it's an uphill battle. If it's going to happen, it's going to happen. Trying to keep your body at a nice homeostatic state where you're not stressed, you're sleeping well, you have a good nutrition, can help your body keep the hairs that you have. At what point would you say it's time for me to seek treatment for my hair loss?
Most people do not notice their hair loss until they've lost 50% of their hair.
Yeah.
And that's just the reality, is that
Right.
we have good coverage, and you can lose a fair amount of hair before you really notice it.
Sure.
So I find that women are often more attuned to this because they start seeing more hair come out in the shower.
Right.
And they will come in, and it's not uncommon that I'll see a woman come in and they'll say, I'm losing so much hair. And I'll look and I'm like, you have a ton of hair. This looks
been there.
great. And the key is that they're losing more in the shower, or that their ponytail used to be this thick and now it's this thick.
Exactly.
So women are a little more attuned to that. Men don't really notice it as early.
Unless their MA takes a picture of their scalp.
Yes. Yes. So if you are a guy and you think you may be at risk for hair loss, and you are in your early and mid 20s, I think that's a great time to come in.
That's the best time.
And start preventative treatment, because if you get to the point where you notice that you're thinning, you've probably lost close to 50% of your hair, and that's a lot more ground to make up. So if your dad, your grandpa, your other grandpa, your uncles, if they're all bald, and you know that genetically this is probably in your future, the earlier that you start intervention, the better results that you're likely to have.
Yeah. And I'll say, I think I was kind of in denial a little bit when it started to happen to me. And I was just like, no, there's no way. Like I'm in my mid 20s, but the earlier you can get on some sort of prevention or treatment plan, the more chance we have to get that hair back.
Yeah.
So
the first time that I really noticed my hair loss is I was an intern. I'd graduated medical school, and I had suspected that I was thinning a little bit.
Yeah.
But I was an intern. I was trying to get into the dermatology program. And they had approached me and said, hey, we would like a representative from our derm program to be at this health fair. And we don't want to go. So would you go for us? And of course, I want to get into the derm program. I'm going to do everything to make them happy.
100%.
I'm like, yeah, I'll go. And they're like, great, come to the office, pick up this table and these pamphlets and some sunscreen samples and go. So I went there in the northern suburbs of Michigan. I set up the table. I had all the stuff. And I was just talking to people in the sun for a couple of hours. And I had sunscreen on my face.
Yeah.
And, on my arms and everything. But at the end of the day, I went to scratch my head. I was like, oh, that hurts.
Oh.
And I got home. I was like, asked my wife, would you look at my head? She's like, yeah, you're sunburned really bad.
Oh, no.
And so I was like, yeah, I had lost enough hair
that I
was getting burned on the top of my head. And then because of the trauma to the scalp from the sunburn, I lost a ton of hair over the next week or two, and I was losing my mind.
Oh, yeah.
And so then I tried starting Rogaine that I picked up at Walmart.
Sure.
And I was so bad at putting it in regularly.
That's the hard part.
Yeah. So we'll get into all of the treatment options, but before we do that, I've got a little bit of a did you know for you.
Okay.
And I'm keeping it on the topic of hair loss.
Okay.
So this was brought to my attention by one of our pharmaceutical reps that came in recently, who has a hairstyle that's on his way to mine.
Okay.
And he had come across this from the University of California, Irvine. Researchers have discovered a new molecule called SCOOB3.
SCOOB3.
SCOOB3, SCUBE3.
Okay, I was thinking Scooby-Doo.
Yeah, it sounds like Scooby-Doo. When I did the Google search the first time, that's how I typed it in. But Google's like, you're an idiot. This is how it's spelled. So SCOOB3 is a signaling molecule, and it's important in embryonic development. It binds with something called bone morphogenic protein. So if you have mutations in that, bad things happen.
Okay.
But they took this molecule and they injected it into hairless mice under the skin, and they grew tremendous amounts of hair.
Really?
Yeah.
Genetically hairless mice?
I don't know. There's something about the genetics of the mice. They weren't growing hair, but they still had hair follicles.
Gotcha.
So it woke the hair follicles up and caused them to produce hair.
Interesting. It was like a, not intralesional, not like it was like intramuscular type injection, or do you know?
I didn't get that part of the study. I think it was just under the skin.
Under the skin.
Yeah. And then they took mice that they had transplanted human hair follicles into.
Oh, wow.
And injected it, and it activated those. So they proved that it works on human hair follicles.
Wow.
And so this is a treatment that would be years away because they have not done any human trials yet.
Sure.
But the way that it works is it tells the stem cells of the hair follicle to wake up and start producing hair again.
Wow.
And so this may be a way to recover hair follicles that have long been dormant in androgenic alopecia.
Really? That's very interesting.
Yeah.
I can already see the pattern of what's going to happen.
Yeah.
Europe or Turkey is going to start doing this. And we're all going to fly over there.
When are the peptide companies going to come out with this and sell it on the black market? And people are going to be injecting it all over.
Yeah.
But
That's wild.
Theoretically, this could work maybe for beard hair as well, facial hair.
Oh, that's where I need it.
So that's, the type of area people will go and get transplants there too. Eyebrows for people that have got thin eyebrows, for all of my generation that made those pencil thin eyebrows forever and now can't grow them back.
Yeah.
So
wow, that's an interesting did you know?
Yeah.
All right, I have a did you know for you.
Let's hear it.
Did you know that water can boil and freeze at the same time?
That's from 32 degrees to 212 degrees Fahrenheit.
Yeah.
So you're going to have to explain how that happens.
So apparently it's something called a triple point, where enough heat and pressure is being placed on water, and it begins to show all three forms of liquid, gas, and solid phases.
Wow. I don't know how you would
It's a
even
weird thing.
recreate those
I don't know how
conditions.
you recreate it, but
Yeah.
it's, scientists like to do stuff like this to prove that it can be done. So
Science. You should cut out the swear word.
bleep it out.
Bleep it out.
Just bleep it.
Just bleep it. So now that we've covered everything you need to know about hair loss, how do we treat it? Well, this is what we do every day in the clinic.
This is what we do.
And we're going to start with the topical medications that are available.
Okay.
The most common thing that people are going to turn to is topical minoxidil. This is available over the counter.
Yep.
The brand name is Rogaine, and it comes in two strengths, a 2% and a 5%. The 5% is approved for men by the FDA, and the 2% is approved for women. Now, what I tell my patients is don't waste your time on the 2%.
That's exactly
Everybody
what I say.
should get the 5%.
Yep. It's basically the same formulation, but when they did their initial studies for the minoxidil 5%, they only studied men. And then later down the road, when they realized, oh, women want to use this too, they couldn't just piggyback on those studies. They had to redo the studies, and for some reason, they picked 2%. And then that was what was put on the market under basically the same formula.
Yeah. And it's not uncommon that they charge more money for the women's 2% than
Yes.
they do for the men's 5%.
If it's pink,
Yeah.
they charge more for it.
Yes. Yeah. What do they call that? The pink tax
The
or
pink
something?
tax, yeah.
So topical minoxidil is going to be the most common thing that you find over the counter.
Yes.
I have instructed my patients to get the generic, the store brand.
Yep.
Get the bulk at Costco. It comes in either a foam or a liquid.
Yeah.
I find the foam, and the feedback from my patients is the foam is just messy and hard to use.
It is.
So typically the liquid in a dropper, you can get it right down to the scalp, and that's going to work a little bit better.
Yep. I personally use minoxidil and have been for probably eight or 9 years now. And I've used both the liquid and the foam. The liquid does leave your skin, your hair, it makes it feel wet a little bit longer, whereas the foam is almost like a mousse, and it can leave it a little bit kind of crunchy feeling. But yeah, you could. It's very cheap. The foams have been more and more expensive and harder to find lately. The liquids are more readily available. The Costco brand, the Kirkland brand, you can buy on Amazon for $19 for $30 for a 6 month supply.
Yeah.
So
That's the way to go.
that's definitely what I usually recommend to my patients, men and women. So baseline, usually when we start, it's with the topical minoxidil, and then we build from there.
Yeah.
Are there any other topicals that you recommend, shampoos or things like that?
So there is some evidence that a ketoconazole shampoo
That's true.
can be helpful.
Yeah.
So ketoconazole is an antifungal shampoo. You can buy it over the counter under the brand name of Nizoral. It's a 1%. In the dermatology clinic, we'll prescribe a 2% shampoo, so you can request that from your doctor or your dermatologist. And it has anti-androgenic activity, meaning it can lessen the effect of that testosterone and DHT on the hair follicle.
Yeah.
You got to rub it into the scalp and let it sit for a few minutes so you get some of that activity.
Yeah.
But it's another avenue whereby you can try to accomplish that. And I find that as we talk about all of these treatment options, the more things that you're able to do in a routine, the better results you're going to get.
Totally.
It's rare to find one therapy that is a magic pill for somebody.
Especially for hair loss.
Yeah.
Doing multiple remedies to try to help is typically better. I agree with you. So ketoconazole shampoo is something that I have used.
Yeah. Also, there's a lot of chatter on TikTok, on social media about rosemary oil for hair loss.
That is true.
People are talking about rosemary oil, that this is like the nature's Rogaine, all of these things. I've looked into the studies on this, and rosemary oil has been studied for hair loss, and it did show some benefit.
Yep.
So if you are allergic to ingredients in minoxidil, you could turn to rosemary oil. A lot of these propylene glycol things that are in Rogaine, some of the brands that are using that as a carrier, can be something people become allergic to.
And be irritating.
But if you are thinking that rosemary oil is going to be as effective as Rogaine, you are misled. So in the studies of rosemary oil, they found that it was about equivalent to 2% Rogaine. They only studied it against 2% Rogaine.
Oh.
And there's plenty of studies showing that 5% Rogaine is far superior to 2% Rogaine.
Yes.
So rosemary oil versus 5% Rogaine, I have not seen any studies where they were studied head to head, but it was not quite as good as 2% Rogaine. It wasn't statistically different, statistically significant difference.
Sure.
But it was the bar was lower for rosemary oil. So if you think that rosemary oil is going to do it versus 5% Rogaine, that's just not correct.
Yeah. Another thing that I've seen is castor oil. Very similar results. It's been studied, and the minoxidil wildly superior. So if you're going to do anything to put on your scalp, I probably would recommend just doing minoxidil.
Once you're in the dermatology clinic, there are additional topical options that we can get into. And one of these is finasteride. Finasteride is commonly taken as a pill.
Yeah.
This was first developed as a treatment for benign prostatic hyperplasia, where men classically their prostate starts to grow as they get older. So this was something that targeted that 5-alpha reductase enzyme in the prostate. And the men in the trial all started growing more hair. And so they were all older men with prostate issues, and all of a sudden they're like, hey, my hair's growing, doc. What's going on? And so the company realized, we've got this 5 milligram dose for the prostate, but if we take it down to a 1 milligram dose, we can market this for hair loss. And it's been a huge moneymaker when it was on patent for the company.
I'm sure it has. And it is beneficial. It does help you regrow hair at that 1 milligram. Now, when a patient comes in and you prescribe the 1 milligram pill, is taking more better?
Taking more is not necessarily better. The 1 milligram dose was shown to be pretty effective for hair growth. It is the most direct approach to combating dihydrotestosterone, or DHT, because it impacts that enzyme 5-alpha reductase directly. Now, some people are cautious about taking it as an oral medicine, which is why it can be compounded into a topical. And this is where we'll work with a compounding pharmacy and often have them take Rogaine and finasteride and put it in a topical. And then you can use this on the scalp with less worry about any systemic side effects.
And it is still very effective.
It's still very effective. So this is what I did for quite a while as I was using a minoxidil finasteride compound. And for about 3 to 4 months, I was seeing new growth on the temporal scalp here, kind of this widow's peak area. And after about 3 to 4 months, I became allergic to the compound. And I started to get super itchy on my scalp. So I went to the compounding pharmacy, we reformulated it, and I started putting it on. And within 2-3 days, my whole scalp, and even down onto my forehead, was just on fire.
That's no good.
And then I tried one more time, and I don't know which specific ingredient it was, but I got so irritated by it that I just couldn't use it. So
that's frustrating.
That's not a common experience for most people. But it did happen for me, and it dashed my hopes on another remedy for my hair loss.
Some of the topicals can be irritating to the skin. Even topical minoxidil by itself from Costco, people can sometimes come back and say, just my scalp is really itchy. Start to form little bumps. So that's something that definitely can happen. But aside from topical medicines, what are some oral medicines that we have available to us?
As we mentioned, the oral finasteride is the most common oral medication that we use in androgenic alopecia. And we'll use this in men at their first presentation if they're interested in it. Because of the way that it works, which we've discussed. The hesitation for oral finasteride is kind of around its side effect profile. And by and large, I would say 98% of my patients that I put on it have had no trouble whatsoever. They either stop losing hair or they do grow new hair. It's always easier to stop the hair loss than it is to grow new hair, but some people do see that they grow new hair with it. The risks with it that are purported side effects are erectile dysfunction, which is the one that causes the most concern if people experience it. And then there are reports that it leads to depression.
Right.
And the mechanism of this is not really well understood from what I'm aware of. We don't know why it leads to depression. And we don't really know why it leads to erectile dysfunction. But it does. I have had patients that have experienced it. And they stop the medicine and they seem to be just fine. So then we get into this whole conversation on post-finasteride syndrome. And this drug has been reported to cause something called post-finasteride syndrome, where even after stopping the medication, some men continue to complain of erectile dysfunction, depression, and I don't know, if you had erectile dysfunction, that'd probably make you depressed. So I don't know if it's causing the depression or not.
The egg or the chicken?
Yeah, exactly. And so there have been lawsuits against, I think it was Merck, who was the first one to bring out Propecia onto the market. And this is something where, I've heard urologists talk about it. They say it's definitely a real thing. In 2 to 4% of people to have these side effects, and then a smaller percentage of that would have persistent side effects. So it's the type of thing where I do counsel my patients on this. If we notice any side effects, we stop the drug immediately. But there's no rhyme or reason who might experience this.
I personally have taken finasteride, and I did notice that side effect. And I didn't have post-finasteride syndrome, fortunately, but everything went back to normal. But it is something that does happen. It can happen. But for the most part, like you said, I've had really good success with finasteride. One of the risks that I have noticed some people do, some of my male patients who they feel like taking more is better. The risk behind that is they use it to treat benign prostate hyperplasia. And so if you're taking more, sometimes if you're developing, especially if you're older, it can mask prostate cancer.
I think that's a good point to cover because it's going to reduce your PSA, your prostate-specific antigen. And
which is the test that we use to check for prostate cancer.
So if we're decreasing the size of the prostate in normal tissue, but there's a tumor, we might not detect that PSA.
Exactly. So that's why I counsel my patients to stick to the 1 milligram. I know if you're starting to see results, it's exciting. You want to take more maybe to get better results, but stick to 1 because even though it's low risk, I'd rather have no risk of masking that. So
do you ever use finasteride in women?
I have used finasteride in postmenopausal women. So I don't use it premenopausal. But it has had good effect for quite a few of my patients who have used it on. Obviously, we don't worry too much about the side effect profiles, but I do talk about decreased libido potentially. But they're going, they're going through menopause or postmenopause, and so that's already something that they're thinking about. But I have had good success there. But premenopause, I don't use it.
I'm generally the same way unless they have had their tubes tied or otherwise had a procedure to render them sterile. Because finasteride can lead to birth defects. If you get pregnant, it will cause developmental abnormalities, particularly if you conceive a male fetus.
And usually post-menopause is when we see androgenic hair loss in women. But it can cause birth defects in the baby, so we don't mess with that. We don't mess with that.
And then oral minoxidil is a treatment that's been around for a long time, but I think experienced kind of a resurgence in popularity over the last 3 years or so. Oral minoxidil, this was developed as a blood pressure medication. And again,
another incidental.
They found that it was not particularly helpful for the management of blood pressure outside the hospital because it significantly drops the blood pressure quick and then it rebounds. So they use it in the hospital in hypertensive emergencies. But what they found again in the trials, people started growing more hair. And so this has never been approved by the FDA for the treatment of hair loss in an oral form. But when you take oral finasteride, we tend to do it at very low doses. The smallest pill that they make is 2.5 milligrams. And for most women, I'll put them on a half of a pill a day. Men start at a half a pill and then work up to a full pill. And it is something that does promote hair growth. It increases the growing cycle of your hair follicle. You can get a bigger diameter of the hair. And so it's successful, but the caveat is that it's indiscriminate.
So you can grow hair elsewhere. And I definitely have had that in women who I've used it on. They start to grow facial hair and things like that. So It's something to talk about with our patients, but yeah, you can grow hair not just on the head.
Yeah. And the other thing to know about minoxidil is it also can cause birth defects.
Yep.
So again, in premenopausal women, we would not use oral minoxidil, and even topical minoxidil or topical finasteride should generally be avoided if you have the possibility of becoming pregnant.
Yes.
So,
how about, have you used dutasteride?
I have used dutasteride. So if I find that a guy has responded somewhat to finasteride, but maybe not as well as we want, we might try dutasteride.
Yeah.
And in postmenopausal women, often I'm doing dutasteride first because it is slightly more specific for the version of the enzyme in the hair follicle.
Yes. So finasteride targets 5-alpha reductase 1, whereas dutasteride targets both 1 and 2.
Okay.
And so it has a little bit broader effect on the hair follicles, but the half-life of finasteride is about 6 hours. So it's in and out of your system really quickly, whereas the half-life of dutasteride, it can be up to 4 weeks sometimes. So something to be aware of, because then having that discussion about side effects, it can last a little bit longer.
Yeah. The other option that we'll sometimes use, particularly in women, is spironolactone.
Yes. I don't use it that often. But studies look good.
Yeah.
I'm not opposed to using it. I think I just prefer more the oral minoxidil or finasteride. But have you used spironolactone to good success?
I have. The times that I'll use spironolactone is in women who present with hormonal acne and hair thinning.
Okay.
Because it kind of kills two birds with one stone.
Totally.
Because it has more broad anti-androgen activity. It's less specific than finasteride. But it does work well for hormonal acne off-label and androgenic alopecia off-label.
Yeah.
It is something, again, that is teratogenic if you conceive a male fetus. So that's the challenging thing with all of these. If you are a woman who is still of the age where you could conceive, is that if you're experiencing hair loss, you need to see a medical provider, because it's uncommon to get androgenic alopecia at that age.
Yeah.
So you need to look for other causes. And the treatments that are available are more limited because of the risk of developing birth defects. Anytime we're playing with hormones, you have to be so careful if there is conception.
Yeah. One of the nice things that we can do, if we have a patient, a female or male, who comes in and they're losing their hair for whatever reason, and we maybe want to put them on a medication, and they want to do a medication, but we want to be 100% sure, we can always do a biopsy of the scalp, and it can show that type of androgenic alopecia, which gives the patients a little bit more confidence in, okay, let's try to treat that specific condition, and you're ruling out autoimmune conditions and other type of scalp problems.
Yeah. I probably should I have taken finasteride as well.
Yeah.
So when I, again, was going through my hair loss, I took finasteride, and I took about one pill every week for a month or two. And I was like, I'm just so bad at taking pills.
I struggle with taking pills. I'll admit, starting minoxidil, so topical minoxidil, something we didn't discuss, is you have to use it twice a day to get the benefits.
Ideally, yeah.
Ideally. That's a hard habit to get into, of doing it twice a day. But once you get in the habit, you can do it. When I took finasteride, after I started noticing side effects, I was like, no. But even then, I was taking it sporadically, because it's a tiny little pill, but I can't take it every day. I don't know.
I'm just bad at taking pills. Like, my doctor gets on me for not taking the vitamins he has recommended to me. So when I realized, I'm just bad at taking this, and I'm really, not going to take this for the rest of my life.
Yeah.
At that point, I was just like, all right, I got to do something else.
Totally.
And to get a little vulnerable with the audience here. So my process is I also did something called PRP injections.
Oh, yeah, you did.
We'll talk about that. PRP, I found that it was really hard for me to do PRP as well, because I'm working all day, and then for a long time, I was the only doctor in the clinic.
Oh, yeah.
And so, I couldn't do it to myself to inject the PRP.
Oh, no, that'd be...
But a couple times I had, Mariah do it, our other PA, and, it just hurt, and I'm like, wow.
Yeah.
And at this point, I've already lost, 70% of my hair, and I'm like, I don't think I'm going to recover to the point where I'm going to be happy.
Yeah.
So at that point, I had made a friend on TikTok called Phil Ring, and he was a barber in New York, and he was doing these hair pieces.
Oh, yeah.
And they looked so good. So I reached out to him. I talked to him on the phone. He referred me to somebody here, and I went and got a hairpiece.
Oh, really?
Yeah. And I was very happy with it for, about 6 months.
Okay.
And then COVID kind of happened, and the company that was making the one that I was using like went bankrupt.
Oh.
And so they only last
rough.
so long.
Yeah.
You know,
You have to replace it.
you have to replace it. And so the one that I got, like I had it for like a month, and then the hair just started falling out of it.
Oh, really?
And if you think that it's emotionally distressing to lose your own hair, when you're losing fake hair, like I was,
man.
Like, this is the worst thing ever.
Yeah, because like I can't even.
Like people are gonna know that I'm wearing a hairpiece and all this stuff.
Oh, was it becoming obvious?
Yeah, I mean, like if I looked, I could see the netting on it.
Yeah.
You know, because they shave your head and then they use a glue and they put it on there, and I would leave it on for, I think it was like 3 weeks.
Oh, really?
Yeah, and it blended really well.
Yeah,
and so then she returned that one. She got another one, and then the color match just wasn't perfect.
Oh.
And I was like, you know what? For the first few months, it did give me more confidence. Like,
yeah,
I was happy with it. And then when I realized like the solution that I was chasing was not giving me more confidence, but making me more self-conscious.
Yeah,
I was like, this is not serving its purpose.
Yeah,
and like the people close to me and my office staff, they knew what I was doing. But at that point I was like, you know what? The game's over.
Yeah.
I'm just going to own it. And so I took it off, scrubbed everything off, and I just shaved my head.
Yeah.
And I've been super happy with that. And it's really just about, I felt like I did everything that I could.
Right.
With the exception of like taking finasteride regularly. But at that point I was already so far gone.
Yeah.
That it just became like an acceptance thing. And that is the other part of the mental health aspect, is that you can just accept it. And I realize that that's easier for men to do than for women.
Right.
But I had to go through those steps to get to the point where I'm like, I'm confident and comfortable just shaving my head.
Yeah.
And I'd rather be bald than balding.
Right. How was that emotionally for you to just ditch the hairpiece and say, I'm shaving my head? Was it distressing for a while?
No, it was so liberating.
It was liberating.
Yeah.
That's great to hear.
It just felt great. I was like, you know what? This is me.
This is me.
Just, I'm not going to try to hide this anymore.
Yeah.
I'm just going to go for it. I made a whole YouTube video on it. It's on my 208 Skin Doc channel. And I just owned it. So
that's great.
Yeah.
And you rock it. I mean, you look great bald. I mean, I had a guy tell me once, I think it was a patient. He said, when God created humans, he gave very few good heads, and to the rest he gave hair.
Yeah. That's awesome.
Yeah.
Yeah, I like that. So we've touched a little bit on the future of hair treatment. So PRP is the process of drawing your blood, spinning it down, getting rid of the red blood cells, taking that plasma and the platelets. Platelets, when you get an injury, they're the first thing to get to that injury, and they release a bunch of growth factors that tell your body, bring in all the good stuff.
Bring in the good stuff.
Let's heal this thing. So there's some evidence that PRP can help to promote hair growth when injected into the scalp. But as I mentioned, it's an uncomfortable procedure to go through. It's lots of little needle pokes.
It's lots of pokes.
And the results are widely variable.
Yes.
There's no standard protocol. Every clinic that you go to tends to use a different company for their centrifuge and their kit. And they do it at different, intervals with the injections. I have found that for younger, healthier patients who don't take medicine and don't have other medical problems, they tend to get the best results. They got that good protoplasm, as we say.
Yeah.
Older patients who are on lots of medications, they maybe have prediabetes or other medical problems. They got that bad protoplasm. They don't have as much good stuff in there to actually get a result out of PRP. So I am very upfront with patients about PRP, and it's an expensive procedure.
Yep.
It is something you add on if you have the money to spend and you're doing everything else. And if that's the case and you want to try and see if it works for you, I'm happy to do it.
Yeah.
But I'm not promising that it's going to be the Bugs Bunny hair tonic that you want.
Yeah. The studies are a little bit misleading because looking at the studies on PubMed, a lot of them will say 80% of people who did PRP noticed some hair improvement. Now, some hair improvement, whether that's for some people, it was just strengthening of the hair. They noticed less hair falling out, but they didn't regrow any hair.
Right.
So reading those studies, I'm very candid with my patients about that because they want to know what is the efficacy of this. I'm spending thousands of dollars on this procedure. Yeah. And I go through all of the ins and outs. What does it look like? And then the efficacy of it. Now, I have seen great results with PRP in the office.
Yeah.
I do it pretty frequently, and most of my patients leave at the end of the 4-ish month period pretty happy.
Yeah.
But I typically, if you do PRP, if you're doing these procedures, you don't want to just do PRP and then leave it alone. Sometimes it'll be touch-ups once a year, or you want to be on finasteride, or you want to be on topical minoxidil. You want to try to keep what you have and what you worked for. So what are some good habits that you can get into to try to maintain healthy hair?
Yeah. Everybody will turn to biotin and supplement biotin.
Everybody turns to biotin.
There's actually, as far as I'm aware, no evidence that biotin monotherapy promotes better hair growth.
There are none that I could find.
So biotin is an important, vitamin for hair growth, but there's no evidence to say you take biotin and you will grow better hair. Certainly, if you are deficient in biotin, you should replace it.
Yes.
It's an important cofactor in lots of other things going on in the body.
Yeah.
But having a healthy diet, eating a wide variety of whole foods, vegetables, avoiding processed foods, refined carbohydrates, added sugars, get good sleep. Those are your lifestyle habits that are going to do the best job for you. If you are thinning a little bit, you should wear hats outside.
Totally.
Because if you get a sunburn, as I experienced, you're going to lose more hair in an inflammatory condition of the scalp.
Yeah.
If you have psoriasis, if you have seborrheic dermatitis, and that inflammation is uncontrolled, that can lead to hair loss. So those are all things to be aware of.
Yeah. One treatment that we haven't touched on yet is red light therapy.
Yeah.
A new and emerging topic, but all the studies that I've seen look very promising. I have yet to try it myself, but they look good.
Yeah, red light therapy, I do think, is an added benefit. It is not a magic bullet by itself, but when used in combination with the topical minoxidil, finasteride, or oral finasteride or minoxidil, I do think that it is a value add. It can promote better blood flow. It can decrease inflammation on the scalp. It has some evidence to suggest it improves mitochondrial activity, which produces more energy, so you have more energy to feed the hair follicles. And the thing that I like about these is that it is a one-time purchase. You're not getting a prescription every month.
Yes.
You're not on a subscription. And we could go into a whole thing on hims and hers and these subscription processes. But you can buy it once and use it for years.
Yeah.
And the cost on these can range from, a couple $100 to a couple $1,000. Yep. And it's going to be different based on the company, the number of LED lights on the inside of it. The brand that I have at home that I used for a little bit is called iRestore. I have no affiliation with them. They did send it to me for free. I used it for a while. It was an every other day for 20 minutes. I plugged it in, and I just took the battery pack, and I would wear it as I drove to work.
Oh, nice.
And I wondered if people next to me are like, what? Is he wearing on his head?
Wearing a helmet.
You're wearing a helmet? Should you be driving? But I do think red light therapy is a value add if you can spend the money on it.
I agree. Looking at all of the data that's been produced through it, and the JAD just released a couple months ago a lot of data on red light therapy for hair growth, for inflammation, for all sorts of different things. Looks very good.
Yeah.
Very promising. So, yeah.
The last thing we should touch on is hair transplants.
Yes.
So,
going to Turkey.
Yeah. Should you go to Turkey for a hair transplant?
What's your experience with that? Or have you had patients who do that?
I have had patients that have gone to get hair transplants. And after I shaved my head and posted a video about it, I had 2 doctors in the U.S. and 1 person in Turkey offer me free hair transplants.
Oh, really?
Yeah. 2 of them just wanted to do it as a courtesy. They weren't looking for promotion on it. Yeah. But the guys in Turkey, they're like, come and do it for free and we'll make a video and then we'll give it to you for free. So I had at that point accepted my hair loss.
Sure.
And I knew that if you get a hair transplant, you have to take finasteride for the rest of your life.
You have to take finasteride.
They take hairs from the back of the scalp and they transplant them onto the top. And as we talked about, the hairs that come from the back of the scalp are not sensitive to the hormones. So when they're put in the top of the scalp, they maintain that property and they won't fall out after they regrow.
Right.
But if you want to keep the hairs that were still on the top of your head, you have to be taking finasteride. And that was one thing I knew I wasn't going to take finasteride for the rest of my life. So a hair transplant wasn't the best option for me. I didn't want to, have a scar on the back of my head or follicular unit extraction. So it wasn't the option for me. And I was not going to fly to Turkey to get it done. I have seen great results from people posting online that are coming from Turkey. Some of these are from the clinics themselves. They post great results, but they're not posting their bad results. Nobody posts their bad results, whether you're in the U.S. or in Turkey or anywhere else. But the biggest challenge is that, yes, you're going to probably save money, even including the plane ticket to go to Turkey and back. But what if you have a complication? It's not like you can call them up and they'll say, come in, tomorrow and we'll take a look. And so that's the biggest thing that I have a problem with when it comes to medical tourism is how are you going to manage complications on an elective surgery where you can't just go back in the next day or the next week and have them check something. So that's the risk of it. And there have been cases where people go over to clinics overseas, whether it's Turkey or other countries, and find out that the person doing their transplant after a complication happens wasn't even a doctor.
Oh, really?
I've definitely seen cases like that.
That's wild.
The person, they were just, somebody that
watched YouTube
or they took a course from somebody, and the regulations are such that they just opened their own clinic in this country, had great marketing, and got somebody in, and they had a bad outcome, but there was no recourse.
That's pretty scary.
Are you going to be able to initiate a lawsuit in another country?
Yes.
So I think you should be very cautious about traveling to other countries to get a hair transplant done. In the United States, there is the International Society of Hair Restoration Surgeons. If you are finding somebody to do a hair transplant, they should be a member of that society. There is no formal residency training in hair transplantation. Most people that do this, many are dermatologists, some are general surgeons. In dermatology residency, I did get exposed to hair transplant surgery. But it was not something that I even spent a rotation on. It was just like one day I watched a guy for half a day that worked in the same clinic. And so you have to go get your own training for hair transplant surgery. So it's often a preceptorship, and that's just the way that it is. But you should work under somebody. You should get certified by the International Society of Hair Restoration Surgery. And I strongly recommend that when you go to somebody for a hair transplant, that's the only thing that they do. It shouldn't be like, I do 1 day a month of hair transplants. We'll get you scheduled on that day. By the way, do you want me to do your leg veins, or you want me to prescribe your hormones, or whatever it is? You want to go to the best, the people that do this day in and day out, because it is an art form to do a hair transplant. You have to harvest the hairs in such a way that you minimize scarring, and you have to implant the hairs in such a way that it mimics a natural hairline, because our hairs don't just all stick straight out of our scalp. Some come at an angle, and you want to recreate. You don't want a strict line where all the hairs are in the exact same line on the front of your scalp. And I've seen people get these jobs where they're getting, a hair transplant, and the frontal hairline is one uniform line, and it just doesn't look natural. Or all the hairs are sticking straight up because they just plugged them in at a perpendicular angle, and that doesn't look natural.
Interesting.
And so there are a couple of surgeons that I've had on my podcast before. Jen Creechy down in San Antonio, Texas, is who I send most people to. And she does hair transplants full time. I have a friend that has gone down to see her recently and probably will end up getting a hair transplant. So full-time hair transplant surgeon. You can discuss whether they're going to do a strip harvest where they cut a long strip out of the back of the scalp and suture it up, or if they're going to do what's called follicular unit extraction, where they take individual hair follicles out, and that way you don't have a scar on the back of your head. But usually you can get more follicles if you do the strip than you can for follicular unit. So it all depends on how many hairs do you need transplanted. How do you want to wear your hairstyle afterwards? So if you like to keep longer hair in the back, you can get a strip and nobody's ever going to see that scar. But if you like to have a buzz cut on the back, that strip is going to be obvious, and you're going to have a better cosmetic result by doing the follicular unit extraction. So I think the hair transplant surgeon, however they want to do it, they should be versed and skilled in doing both. There is a place here in Boise that does hair transplants, and they rent the machine, they rent the tech, and they do it, that once a month thing. And I tell people strictly that I see there's nobody in Boise that I would confidently send you to get a hair transplant.
I have had one patient who went to Turkey, had the hair transplant, and he came back and he was starting to develop keloid-like scars on the back of his head. And when he called them, their recommendation was go see your dermatologist. And he ended up on my schedule. This was a while ago, but
that's a complication that they should be managing for no additional cost. But now he's spending money on a new provider to manage a problem that he probably wasn't even informed could happen.
Yeah, and now he has nowhere to go. So he's here, and we do our best. But at the end of the day, you gotta be taken care of by the people who did the surgery.
So get your hair transplant done in the U.S. with somebody who that's all that they do. That's the recommendation that I have.
That's a great recommendation.
So before we close out, I want to introduce you guys to the product of the week. I don't have Rogaine here or finasteride that I can give you. So what I did is I grabbed a sunscreen. This is from Soul Labs. If you are balding on top, you should be wearing sunscreen or hats on the top of your skin. So Soul Labs is a zinc oxide titanium dioxide sunscreen. So it's a physical sunscreen. It comes in a pretty good size. This is 4 ounces, not TSA friendly, but this is a really cosmetically elegant zinc-based sunscreen. I've tried this. I love it. It blends in really sheer. And so it also has astaxanthin in it, which is an antioxidant for the skin. It is water resistant. So if you need daily protection, Soul Labs, very good sunscreen. We'll have that link down in the podcast show notes.
Awesome.
Guys, thank you so much for joining us on this episode of Skinfluence. I'm Dr. Dustin. You can find me on social media at Dr. Dustin Portela, Dr. Dustin Portela, on all social media platforms. And if you have enjoyed this podcast, leave us a 5-star review, share this podcast with a friend. And Austin, thank you for being here as well.
Yeah, happy to be here. You can find me at Austin Lee, Leepac, on TikTok and on Instagram. And if you have experiences with hair loss, or if you've had experiences with some of the treatments or things we've talked about, leave a comment. We'd love to hear from you.
Catch you next time.